Which bladder cancer risk factors should I be concerned about? Imagine a tiny organ inside your body that holds your urine and plays a key role in your health. While it's resilient, certain factors can increase the chance of developing problems like bladder cancer. Understanding these risk factors can help you stay informed and proactive about your health. The most significant risk factor is tobacco smoking. Cigarettes contain harmful chemicals that enter your bloodstream when you smoke. These chemicals are filtered by your kidneys and end up in your urine, exposing your bladder lining to carcinogens. The more you smoke and the longer you smoke, the higher your risk becomes. Quitting smoking can gradually lower this risk and improve your overall health. Exposure to certain chemicals used in industries also raises the risk of bladder cancer. Workers in jobs involving dyes, paints, rubber, leather, textiles, or petroleum products may encounter carcinogenic substances called aromatic amines. These chemicals can damage the DNA in bladder cells over time. People working in painting, printing, rubber manufacturing, or leather processing should be especially cautious and follow safety guidelines to minimize exposure. Age is another important factor. Most cases of bladder cancer occur in people over 55. As we get older, our cells are more likely to accumulate genetic changes that can lead to cancer. Men are also more likely to develop bladder cancer than women, possibly due to differences in exposure or biology. Race can influence risk too. Studies show that white individuals tend to have higher rates of bladder cancer compared to black individuals. While the reasons aren't fully understood, genetic and environmental factors may play a role. Family history and genetics also matter. If a close relative has had bladder cancer, your risk may be higher. Certain genetic mutations like those in HRAS, RB1, PTN, NAT2, or GSDM1 genes can also increase susceptibility. Medical history and environmental exposures are additional factors. Past radiation therapy to the pelvic area or treatment with specific chemotherapy drugs, such as cyclophosphamide, can increase risk. Long-term use of urinary catheters, exposure to arsenic in drinking water, or infection with parasites like Schistosoma hematobium, more common outside the United States, are linked to higher bladder cancer risk. Some diabetes medications, like pioglitazone, have also been associated with increased risk after prolonged use. It's important to remember that having one or more of these risk factors doesn't mean you will definitely develop bladder cancer. Many people with risk factors never get the disease, and some without known risks do. Staying aware of these factors can help guide discussions with your healthcare provider about screening and prevention. Maintaining bladder health involves avoiding or reducing exposure to these risks whenever possible. Quitting smoking, being cautious about chemical exposures at work, and staying informed about your medical history are good steps. If you notice symptoms like blood in your urine, frequent urination, or pain during urination, seek medical advice promptly. Early detection and medical evaluation are key to better treatment outcomes. Remember, your health is a journey, and understanding your risks empowers you to make informed choices.